Marley Drug.
Hi, my name is Monica and I'm a pharmacist who works with Marley Drug Pharmacy. Today we're going to discuss hemorrhoid relief. Let's start by discussing what hemorrhoids are. Hemorrhoids are basically swollen veins in the lower part of your rectum and anus, which can cause discomfort, itching, or even bleeding. People often ask, what causes hemorrhoids? And there are several reasons. One of the most common causes is straining during bowel movements, which usually happens when you're constipated or have diarrhea. Sitting for long periods, especially on the toilet, can also put pressure on those veins. Pregnancy is another common factor as the baby's weight increases pressure on the pelvic area. Things like being overweight, having a low fiber diet, and even heavy lifting can all contribute to the development of hemorrhoids too. As for symptoms, it really varies from person to person. Some people may feel itching or irritation, while others may notice pain or swelling. You could also have some bleeding during bowel movements, especially with internal hemorrhoids. So when should you consider using over-the-counter treatments? Well, if you're dealing with mild symptoms like itching, discomfort, or swelling, over-the-counter products can usually help. If you notice a little bit of bleeding during bowel movements or small lumps, you can try these treatments to relieve the symptoms. However, if things aren't improving or if you're in a lot of pain, it is best to check with your doctor to make sure there isn't something more serious going on. Now let's talk about some of the over-the-counter options. Hemorrhoid creams and ointments are probably the most popular. These products usually contain ingredients like hydrocortisone, which is a mild steroid that helps reduce inflammation and itching. There's also phenylephrine, which shrinks swollen blood vessels and can really help with the swelling and discomfort. A common over-the-counter product that often comes up is Preparation H ointment. It contains phenylephrine to shrink the blood vessels and mineral oil to create a protective barrier on the skin, which helps prevent further irritation. For cooling relief, you might try something like Preparation H cooling gel. It has witch hazel to reduce swelling and aloe vera to hydrate the skin. This is a good option for external hemorrhoids, especially if you need fast-acting relief. Wipes and pads are also great for quick relief, especially when you're out. They often contain soothing ingredients like witch hazel, which is a natural anti-inflammatory, and aloe vera, which helps calm and moisturize irritated skin. Witch hazel is especially good for external hemorrhoids because it tightens the skin and reduces swelling. Aloe vera adds a soothing, hydrating effect that can make you feel more comfortable throughout the day. An example is Tuck's medicated pads, which I often recommend. They contain witch hazel and aloe vera, which make them perfect for soothing external hemorrhoids. They're easy to carry around and can be used throughout the day, so they're super convenient if you're on the go. There are also a few at-home treatments that can really help with symptoms. For instance, I always recommend taking a warm sitz bath. You just soak the affected area in warm water for about 10 to 15 minutes a few times a day, and this helps reduce inflammation and promotes blood flow to the area, which speeds up healing. Another easy tip is to apply cold compresses or ice packs to the area. This helps with swelling and can numb the pain, especially after a bowel movement. Diet also plays a big role in managing hemorrhoids. A diet that's rich in fiber can help prevent constipation and reduce the strain during bowel movements, which is key for avoiding hemorrhoids in the future. I always recommend patients to increase their intake of fruits, vegetables, and whole grains, or even consider a fiber supplement if they're struggling to get enough from food. However, while these over-the-counter treatments and at-home methods work well for most people, there are times when you should see a doctor. If you're experiencing severe pain, or if you notice heavy or continuous bleeding, it's important to get checked out. If you've tried all these methods, but your hemorrhoids keep coming back or they're significantly affecting your quality of life, it is worth talking to your healthcare provider. They might suggest stronger medications or even consider non-invasive procedures or surgery if needed. With the right combination of over-the-counter treatments, lifestyle changes, and professional guidance when needed, you can find relief and get back to feeling comfortable again. You can read more about hemorrhoids, over-the-counter medications, and products, as well as other topics on our website, so check those articles out in the links below. And if you have any questions, be sure to ask your doctor or leave them in the comments below. And don't forget to subscribe. Bye for now.